We're good to go? Okay. Good afternoon, everybody. Thanks for joining us. I want to begin, as we always do, by acknowledging we're on Treaty 1 territory and the traditional homeland of the Métis. I'll just have some brief opening remarks, and then Jay Shaw, our Assistant Chief Emergency Management, can provide you with a more detailed update on a few topics. So the month of November was a difficult month for us here in the city of Winnipeg. We lost a lot of Winnipeggers sooner than we would have if it weren't for COVID-19. Provincial health officials have been providing us with public updates on an almost daily basis. From those updates, we've learned that in the month of November, there were 6,734 new positive cases of COVID in the city of Winnipeg. To put that in perspective, 63% of all of Winnipeg's cases to date were in the month of November. In November, there were an additional 168 deaths of Winnipeggers. 72% of all Winnipeg deaths came in the month of November. These numbers should underscore for all of us why we all need to take this virus very seriously. Stay home if you can. If you need to leave your home for work or for essentials or outdoor exercise, please wash your hands regularly, wear a mask, and watch your distance. So the holiday season is coming up. I want to encourage Winnipeggers to plan now for a different kind of holiday season. So for example, if you celebrate Hanukkah, or like my family, you celebrate Christmas, I'm asking Winnipeg families, be prepared to celebrate in a different way and find new ways to tap into the spirit of the holiday season in terms of community giving, if you can, in terms of connecting with family and friends in ways that are appropriate and safe under provincial public health orders. With respect to retention ponds and rivers, I want to be really clear. Currently, the rivers are closed. Water retention ponds are always closed. The retention ponds that we have throughout our city, they're not safe to be on at any time of year. We have to utilize the options that are available under provincial public health orders. Skating isn't one of them right now unless it's in a backyard rink. I do want to encourage our residents that want and need to get outside for physical exercise, for just your own mental health. I get it. Please do so. Get some fresh air, but please make sure that you are doing it safely. You're utilizing our walking paths and active transportation amenities. But of course not in groups. Very pleased, you'll hear today from Jay in a moment some information about the first responder testing site. This was an idea that I had first raised with the Prime Minister and then our Minister of Health. Very pleased that we were able to work collaboratively with the province of Manitoba to operationalize a testing site for COVID that's focused on first responders. Pleased that about 20% of those utilizing the site are for personnel from other levels of government, including the province of Manitoba. And so we're pleased to play a support role and assist in this way. There are a number of things that we've been doing to support the province and the outcomes that we all want and that Manitoba Health is trying to achieve. Back in the spring, it was community service ambassadors. Now it's bylaw enforcement officers. The first responder testing site, as I just mentioned, assistance from Public Works for traffic around schools and testing sites, and even the 311 service. We have and will continue to play a collaborative role because after all, we all want the same outcomes for the health of our community. And we're also, as municipalities across Canada from coast to coast are doing, we're also just making sure that we can weather the COVID storm by making sure that the critical services that our residents rely upon, whether it's 911, 311, transit services, or clean and safe drinking water, are there when our residents need them right now. With that, I'll turn things over to Jay and be available to answer your questions. Thanks very much. Merci and miigwech.
Thank you, Mr. Mayor. Good afternoon. My name is Jay Shaw. I'm the Assistant Chief of Emergency Management. I'd like to start off with some safety messaging for all of our residents. I know I'm starting to sound a little bit like a broken record on this, but I will once again remind residents to stay off the ice and exercise extreme caution around all Winnipeg waterways. We have been very fortunate to have such a beautiful weather over the past couple of weeks, but it means that our ice on our waterways is not safe. Ice surfaces are thin and fragile, and falling into cold ice water can be deadly. While we're looking forward to being able to skate on the river trails when it is safe, I will remind you that the ice on our retention ponds is never safe to be on. Ice conditions on retention ponds can change quickly and without warning, creating an extreme hidden hazard. During the winter, water from snowmelt or nearby water main breaks drain into the retention ponds. This winter runoff often is mixed with street salt, and it can cause the ice to melt and thin quickly. The water enters the ponds underneath the ice surface, resulting in a thinning of the ice that can't be seen from the surface. Do not use ponds as skating rinks or any other recreational activity. Parents, speak to your children about the dangers of thin ice on our waterways. Dog owners, keep your dogs on their leashes around thin ice. We have also had a couple of our bylaw officers out to visit the neighboring retention ponds to remind residents of the dangers and to help remove items that have been set up on the ponds. I would also like to remind everyone that you should only be using Winnipeg Transit for essential trips. Don't use Winnipeg Transit to go get a COVID test. If you're using Winnipeg Transit, remember that you are required to wear a face mask. We also ask that you maintain a reasonable separation between yourself and others. Don't board the bus that does not have enough room for you to keep proper social distancing between yourself and others. And if possible, exit via the rear door to reduce crowding. 9 of the city's bylaw enforcement officers are continuing to work with the province to assist on enforcement of specific public health orders. Since last Wednesday, our bylaw officers have inspected 566 locations. Of the locations inspected, one $5,000 ticket was issued to Spirited Music for non-compliance, as it was determined that they were opened when the public health orders have required them to be closed. No tickets have been handed out to individuals in the past week. On Friday, November 20th, the dedicated first responder COVID-19 testing site opened at the Winnipeg Fire Paramedic Service Training Academy. The site, which is staffed by licensed paramedics that are currently not working in the field, completed 93 tests of both city and provincial first responders in its first week of operation. At the same time, the testing site is working in partnership with CAD/HAM Laboratories to engage in a validity study of the Abbott ID Now Rapid Response Test. Some people who receive a test at this location will receive both the traditional nasal swab test and the Abbott ID Now Rapid Test. The results a person receives are based on the traditional test, but the results of the rapid test are being compared with those results to help determine the accuracy of the rapid test. And finally, I will say we need everyone to stay home. Remember to please wash your hands, wear a mask, and watch your distance. We can now take your questions.
Joyanne from the Winnipeg Free Press.
Hello. So for the device that you just mentioned, can you please, I guess, just repeat how that works? I can't remember, I didn't catch the exact term of what it would be. So we're just saying they'll randomly select some people going to the first responder testing site and do both tests, and then that goes back to the province to sort of inform where these rapid tests are best used. Is that?
Yeah, I think you nailed it. Basically, the process is that when you're symptomatic, you book a test on the provincial website. You select the Fire Paramedic Service Academy for testing if it is allowed for you to do so in terms of the scheduling for first responders. And when you show up at the site at your allotted time, what happens is there's a determination, and if you're eligible for the Abbott ID test, then you will get that, as well as the nasopharyngeal regular swab test. And we can look to provide more information on the research project that's happening with CAD/HAM Labs. This is a great program and a really good collaboration between the province and the city. And we're excited that this has gone through its first week, and it's a really good program, and it's going to make a difference.
Sorry, so this is already started, and is it just randomly selected, or are you kind of doing this for all the tests? You're giving them both now?
Yeah, so that we're using both right now.
For all people for all the first responders who come to that site?
If they meet the eligibility, correct. There are some medical questions and some eligibility criteria for the rapid ID test, but for the most part, both tests are being used for everyone.
Okay.
Mike from CTV.
Hi there, Mike from CTV. I'm just wondering, what kind of impact is COVID having on absences and overtime in the fire service? There's a lot of OT, and the OT budget is higher than normal.
Yeah, so I would say that first responders are for sure seeing an increase in overtime because of COVID, but that is the same in the public sector and the private sector around continuity operations in small, medium, and large businesses and in government. But yeah, absolutely right now we are seeing, due to the public health orders and the fact that people need to self-isolate and follow the rules so that we're not spreading COVID, you are seeing some absenteeism increases. We're managing, and we've got good programs in place, and our directors and leaders are doing a great job making sure that we're providing those critical services.
Mike, if I can just add, I mean, that's the reason, it's one of the reasons why we initiated dialogue with federal and provincial officials about the first responder testing site. It's to minimize the amount of time that our first responders need to be in line if they need to get a test. It also frees up some space for the rest of us if we need to get a test. And so that's one of the reasons was to just anticipate challenges to the integrity of our first responder system. And so I want to thank them for all the work that they're doing right now. They're on the front lines.
Did you have a follow-up, Mike?
I don't, thank you.
Okay, thanks. Kevin from Global.
Good afternoon. Sorry if I missed it earlier this week, but were any city workers able to be redeployed to the province? What were the final numbers there?
There haven't been any that have been redeployed to date. In terms of, if I caught your question correctly, were you asking about the province?
Yeah, the city workers that were facing layoffs, have any of them been redeployed at all, whether it's to the province or in other spots? I know I guess the deadline was Sunday, so
yeah.
Have any been redeployed at this point?
Not to date, though, that we'll let you know when and if we have anything that we can announce. But key word there is temporary. These are temporary layoffs, and we're hoping that it'll be short-lived, but to date, we don't have anything that we can announce today.
Are you surprised the province hasn't been able to find at least some room for some of those workers? Because I know you've said in the past that it's clear the province needs some help. So are you surprised that no space has been found yet?
Well, look, I mean, these staff were temporarily laid off as a result of provincial public health orders. It was going to happen as a result of that. We are trying to just provide options to the province, and that dialogue continues. On the broader issue, I've been saying for some time that I think the province should consider seeking the assistance of the Canadian Armed Forces and other third parties where they can get assistance, because I think it's clear to Manitobans that they need assistance. And wherever and however that assistance is obtained by the province, I think the key is that they just get the help where they feel they need it. And I think it's been pretty clear to Winnipeggers and Manitobans that they need some help. And we're trying to do what we can on a number of fronts to provide that support and assistance to Manitoba Health.
Sean from CBC.
With respect to, a lot of messaging here on staying off the retention ponds. Is this a practice that the city of Winnipeg has been rigorous about in the past? In other words, enforcing not building rinks on the retention ponds and its continuity of that? I don't recall that kind level of enforcement and warning?
So Sean, the sort of two things have kind of happened that has sort of brought this to the a larger attention. One, the risk has always been there because the engineering and the safety factors have been the same the whole time. Retention ponds, we do have a waterway bylaw, frozen waterway bylaw. Retention ponds have never been safe. And we have done sporadic enforcement when needed. The reason why this has become so apparent is because COVID-19 is forced cascading consequences on all of us. And one of them is the shutting down of hockey rinks and ice skating facilities. Because of that, folks are naturally looking for other ways, other venues to be able to get outdoors safely. And because retention ponds look like such a fabulous idea, you can't really see the hidden dangers underneath the water. The pipes come in from underneath the ice. That water is mixed with salt, different temperatures. It can thin that ice out. From the surface, that retention pond looks like a great place to play, but actually, we never truly know what the level of ice thickness is, and it is dangerous. So it's always been something that we've said don't do, but we are seeing a tremendous amount of folks that are looking for those outdoor uses right now. We hope the second that the COVID-19 numbers go down and the public health orders change, that we can get people back on our outdoor rinks and at our community clubs, and we can do those things that we cherish so much. But for right now, the message is to stay home. You can build a rink in your own private backyard as long as you're following the public health orders for gatherings. So you want to make sure you're following all those orders. But right now, we're asking people to stay off the retention ponds and make sure that you stay safe. So parents, please take that opportunity. Talk to your kids. Moms and dads, if you're thinking about it's a good idea to get out there with hockey, it's not. We're asking you not to do that right now. Follow the public health orders, and let's get those rinks open, our community center rinks and all of our other rinks as soon as we can when those public health orders allow it.
I'll just echo that, Sean. I mean, we've always communicated that they're unsafe. But this year, I mean, we have, the province has closed our recreation facilities and indoor hockey rinks. And so, and also people are at home, and where they have water retention ponds in front of them and their kids are at home, and this is Canada after all, I mean, there's ice. People want to play hockey, we get it. And so you're combating the instincts of Canadians who want to get outside and enjoy themselves. And so with all of the factors, we are communicating more than ever before, just because firstly, we don't want to see a loss of life. We don't want to see people go through the ice. The secondary issue is we don't want to divert first responders right now at a time when we know they're being called by, to help out at personal care homes, for example. We don't want to stretch those resources any more than necessary. And so that's why we're trying to communicate even more than we've done in the past.
Okay, with respect to the rapid response tests that you're piloting, can you give me the turnaround time? And I'm sorry, I didn't catch the name of the collaborative company that it sounded like Abbott or something like that.
Yeah, the name of the test is called the Abbott ID Now. It's a rapid response test. I don't have all the specifications on how fast the test provides a result. I believe it's in within the 15-minute mark, but I would have to go back and verify that for you, Sean. But the validity of that test is very strong in terms of the positive result, but not so much on the negative. And that's why we're working with the province of Manitoba to do some studying. Great machine, has a lot of great purposes for the right use. Very happy to work with the province on this, and very happy to work with our paramedics and our team to be able to make sure that we have this this service so that we can get quick testing for all of our responders so we can keep our continuity going.
James from the Winnipeg Sun.
Yeah, good afternoon. In terms of lifting code red, what COVID numbers is the province looking for?
Well, I think you would have to ask the province for that question, but I think the reality is, and as the mayor spoke, is that we need to start thinking about what the next few weeks look like and to make sure that we're prepared for the new normal, that we could be in an extended code red for a few more weeks or maybe longer, but that would be a question for the province. But right now, we need to focus on the fundamentals. Stay home, wash your hands, wear a mask, watch your distance. You really should be going out for essential trips only. And if you do that, we're going to get those numbers down. Right now, we're plateauing. You can see the numbers aren't exponentially growing, but they're not also exponentially lowering. So we've got a little bit of time left. And just remember that if we keep working on this together, we're going to get out of this faster. And, we don't go from code red straight to code green. So, it's going to be a bit of a haul. We're in this together. We got this.
Is there any question to the reliability of these rapid tests?
I think that's what some of the research is looking at. They're great machines. This is a process to be able to utilize them and to get the best use out of them. And that's why we say we're happy to be able to work with the province on this great program. And we want to be able to support and keep the continuity up for our first responders and 911 operators.
Joyanne from the Free Press.
And sorry, just to get the timeline of this rapid testing at the first responder site, how long has this gone on for? How long is it going to go on for?
So I believe it started November 20th, and we right now, I don't have an end date for you, but we're gonna keep going as long as we're working collaboratively with the province and keep doing this, because there are benefits to this program. And we're hoping to make sure that it does its job in maintaining continuity of operations for first responders.
I'm guessing a lot of it's to check the accuracy. So do we know, I'm guessing you're not using that rapid test solely to determine if someone, can come back to work and is safe to do so, or are you at this point?
Yeah, so I can't get into the specifics because I don't have all the details in front of me, Joyanne, but basically there has been great collaboration with occupational health and safety specialists, with our nurses, with the province, to make sure that, everything that's happening there, that we're following all the public health orders, and that for the number one reason is to make sure we can maintain continuity of operations for our responders. So right now, the program's working good. We've done 93 tests so far, and we're looking forward to the next week as we keep doing this.
But Joyanne, you were asking if there's, it's not the one test, there's like the two.
Yeah, I
Yeah,
was trying to
okay.
figure out if we're relying on the results from these at all, or if we're just comparing data so we can send it to the province and make a case for whether it should be used or not.
Yeah, let me see if I can get you more information on the actual CAD-HAM laboratory research project that's happening, but right now, we're using both sets of tests. So you get the nasopharyngeal swab and the Abbott ID, and we're working with our OC health nurse and paramedics to make sure everyone's safe.
Kevin from Global.
This question might be for the both of you, but we're hearing more and more about who should be considered for the vaccine first whenever it is approved and rolled out and comes here. Do you guys have thoughts, or what are your thoughts, if you can say them, on who you think the vaccine should be provided to first here in Winnipeg and in Manitoba?
Yeah, I'll maybe just start a high level. A lot of dialogue right now, I know, going on between provincial and federal officials, and we're obviously hopeful they'll be able to sort things out and develop a clear plan going forward. I think what's really important when it comes to COVID messaging, including vaccines, is that there is clear, calm, and consistent messages from officials at all levels of government with respect to the benefits of vaccines. What we need to ensure is that when the vaccine is deployed, that we have as many of our residents getting the vaccine as possible. And so I just hope that that messaging can be clear, calm, and consistent from all levels of government. And with respect to the deployment, we will be there to provide assistance as requested, and as we can accommodate when and if it comes from other levels of government, including the province of Manitoba.
I don't have anything to add.
Sean from CBC? Sean?
Oh, sorry about that. Can I ask about redeployment of the approximately 600 people that have been laid off? Has there been any effort to redeploy within Winnipeg Civil Service? There was a motion today in front of Protection calling for seasonal workers to do maintenance in parks and other rec facilities. Has there been any sort of creative thought about any of those 600 people?
Yeah, so not specifically about any one program, but we are actually doing, from our continuity planning, we are actually, we look at all those types of things. So is there an opportunity to bolster or look internally inside the public service to be able to support? We also, look at this from a continuity of operations going forward for, not just over the next couple of weeks, but what does this look like as we get January, February, March, April? Right now, I'm working with directors to be able to determine what needs are for continuity of operations. There's some plans in place that we're working on, but I have nothing announced right now in terms of redeployment of staff.
The other thing we can point out also is that I was pleased to see that our library staff were able to really demonstrate some innovation in terms of contactless drop-off and pickups. And so this is a way in which they can continue to provide their services, but also we can provide the services to our residents in a way that we're seeing out there in the private sector in terms of curbside pickups. I mean, this is being operationalized differently than when you would see at some of the retail outlets, but to be able to provide those services in just an innovative way is something I've been really pleased to see our public service to be able to accommodate.
You mentioned that bylaw enforcement had been to 556 locations since last Wednesday, issued one $5,000 ticket to spirited music. Any other warnings or tickets issued under that week of enforcement?
Not that I have in my notes, no. I can tell you that the bylaw officers are out there. There's 9 of them. They're working collaboratively with their provincial counterparts. And for the most part, what we're seeing is enforcement, and we're on a bit of a loop in terms of making sure that we're following the public health orders that we've been asked to enforce in terms of closed businesses. And for the most part, we're seeing good compliance, and we're actually having good conversation with business owners. People are starting to feel the effects. They've been feeling it for a while, but we're seeing resiliency, what we want to continue to see is people following the public health orders, and our bylaw officers are just doing their best to be able to inform and get good information out there. No one wants to get a ticket, so if you follow the public health orders, you're going to keep that money in your pocket. And hopefully we can get through this over the next couple of weeks, and maybe hopefully soon we can start to see some public health orders lifted.
James from the Sun?
Yeah, I just have a politics question, so I can wait.
Sure, that would be fine. I'll come back to you at the end. Joyanne from the Free Press.
Okay, and sorry, just so I'm keeping up, that's for the business ticket, it's just the one and it's being open when it's supposed to be closed again?
Correct.
Okay, that's it for me on COVID.
Did you have other questions outside of COVID? Because I'll circle back after then.
Sure,
Okay.
I'll stay on.
Kevin from Global, did you have any final COVID questions?
I do not, thank you.
Okay, thank you. Sean from CBC, did you have any final COVID questions?
No, just I'll wait till Jay can duck and cover from the political stuff.
Sounds great. Okay, so I think that's the end of COVID.
You'd give more interesting answers for you. Thanks very much, Jay.
Thank you.
Okay, are you good, Adam? Okay. My reporters shrunk. Okay, we'll start with Joyanne then.
Okay, Joanne.
Hello, just, I guess for the public washrooms motion, we're hearing some of the first locations for the temporary ones, and then there's some progress on permanent one coming soon. I guess if you can speak to why, I think that you had spoken in support of this in the past, if I recall correctly, just why this is so important for Winnipeg.
So, so yeah, I'm happy to do so, Joanne. I haven't seen the motion you're referring to, but.
It was an update at committee, not a motion.
Okay. Yeah, I mean, in terms of, I mean, look, when the last time the last public bathrooms were removed, I mean, the city was quite different than it is now. We've got a lot more people living in downtown. So, you know, for me, you know, what's been communicated by a number of Winnipeggers is it just comes down to dignity and trying to make sure that that folks have a place to go, and we want to accommodate that, and we want to make sure that we provide our residents with the dignity that they deserve. So, looking forward to seeing the update from the committee.
Okay. That's it for me for now.
Okay,
Okay,
James,
thanks, Joanne.
anything?
No more questions, thank you.
Okay.
Okay,
Thanks. I like your
Sean?
office.
Hang on, Sean. Sorry, Sean, I muted you by accident. Go ahead.
Okay.
Hey, Sean.
Mayor Bowman, as we work through the preliminary budget, and we're in protection today, so that's community services and police. And if you're, I know you're aware of what transpired in the spring and the summer with respect to communities across North America reacting to policing. And I'm going to give you a broad question, because if we get into
Sure.
the specifics, it'll be hard, and you want to see the recommendations as they come out. But
Yeah.
do you feel that this budget begins to strike a balance between what some would call for defunding the police and more support for community services, and others would be very wary of cutting back on police complements or overall funding for police service?
Yeah, I mean, look, this is not an easy budget update for the Winnipeg Police Service. They're being asked to find $15 million from within their budget over the next 3 years, and so they're going to have to dig deep to make some difficult choices. You know, what I would say is, you know, and I've written about this on my my website as well, Sean, if you want to go back and reference some of the initiatives, whether it's the Bloomberg Harvard initiative in terms of how we deploy services to get the right resources to people at the right time. That's a pretty important effort that is ongoing. But let's also look in this budget. I mean, one of the calls from many Winnipeggers is just increased investments in things that build healthier people, healthier community, and that includes investments in recreation. And so, you know, $50 million for recreation and library strategy that's just gone through council is part of the budget. These and other investments in the budget, I think, should be well received by those that would like us to deal with root causes of crime, to build healthier people and healthier communities. And that's something that members of council and I have taken to heart. You know, the calls for the abolition of police services, I mean, that's a non-starter for me. I don't think that's the answer. I think we need to be responsible without an alternate service to be able to respond to the safety needs of our residents, there's going to be funding that's going to be made available for the Winnipeg Police Service. But there is absolutely massive investments in things that build a healthier community. And that's something that I hope all Winnipeggers can get behind.
Fair to your point, but I would, a $15 million cut to the police service is a direct result of a misstep in attempting to change officer pensions. That is not reflective of the desire to rebalance between policing and community services. And the police service is getting a 2% increase overall and then has to cope with a mistake. Would you acknowledge it's a mistake, and would you acknowledge that $15 million has nothing to do with changing the orientation between community service and police?
No, I don't think I'd accept that preamble, Sean. I mean, look, we've had politicians talk for decades about the police pension, and we had the courage to try to tackle it, and we're going to continue to try to tackle it. You're right that the $15 million does relate to the arbitration ruling. And the choice that we could have made in this budget was to not ask the police service to absorb any of the $30 million. That I would have expected in previous councils would have been the default position. But we haven't done that. We've worked collaboratively with the police service and the police board, and so it's still $15 million. Also, the focus and the investments that I've been making and members of council have been making on recreation and all of the things that many have called for us to really put more time and attention and dollars, delivering $50 million for recreation and library strategy, that's not chump change. I mean, that's $50 million. And so I'm really proud of that, and I think it's going to go a long way to building a healthier community, certainly over the next 3 years.
I was not attempting to frame the police pension issue as a mistake based on the direction.
Okay.
In other words, your desire to do some changes to police pensioning. What I used the word mistake for was that in carrying out that directive, it failed. There was an evaluation of can it be done, and it couldn't. And an arbitrator said very clearly, and you're a lawyer, you read that, very clearly it couldn't be done. So, I mean, I wanted to make that clear, and perhaps I'll leave it at that.
Yeah, no, fair enough, Sean.
I don't have any follow-up.
Yeah, no, and fair enough. You know, what I'm trying to say though is that, you know, we're not carrying on with the same focus that you've seen in previous administrations. We have been as very aggressive at trying to mitigate what I would say were out of control runaway costs for policing. And we've done that through a number of efforts, whether it's been, you know, negotiated collective agreements. There is the ongoing effort to deal with the police pension, but also, you know, to really focus massive investments in areas of community wellness, and that'll continue. And I hope that's something that Winnipeggers can get behind. I know members of council are really excited about some of those investments, which that is a major part of this budget update, is that focus on how we build community wellness and health.
Good. I'm good. I have no further questions.
Okay,
More
thanks,
this
Sean.
afternoon.
Joyanne, you're good too?
Yeah, sorry, that just took a while to find my unmute button. I am
okay.
good, thank you.
Okay, thank you.
Okay, thanks, guys. Stay safe. Have a good afternoon.
Thanks.